Hello, my name is Dr. Fؤاد Hashim. I'm a consultant plastic surgeon, Eجمل Clinic. I'd like to talk today about rhinoplasty. Rhinoplasty is one of the very complex procedure that a lot of people ask about it. The rhinoplasty is divided into multiple kind of a procedure depend on the patient or the person problem. It can be decrease in projection, depend on the ethnic background of the patient. So it is even though it is a very simple sometimes, but it can be very complex depending on the deformity. Many causes of deformities can happen to the nose, whether it is from congenital thing or from trauma, from God forbid cancer, can affect the nose, and then that will can cause the deformity. The most common thing that people ask about the nose is that either there increase in the bridge of the nose, projection of this, or increase in the thickness of the tip of the nose. So that is the most common thing that we face with nose deformity. There is different technique in tackling the nasal problem. If we talk about the dorsum of the nose, which we call nasal hump, this nasal hump most of the time, if you look at the nose, the upper part of the nose is bone, the middle part of the nose is cartilage, and the lower part of the nose is cartilage. So when we talk about the hump, which is partly bony and partly cartilage, we have to lower the bone by rasping the nose or removing the bone slowly, removing part of it, and then dealing with the cartilage, which is two parts, part of the septum of the nose and part of the lateral wall of the nose, or the walls of the nose. We have to lower it down. To do this, we have many techniques. The most common one is either through inside the nose, or incisions all inside the nose, or incision, a small incision here in the tip of the nose, and the rest of the incision inside the nose. This technique, when we do incision inside the nose, we call it the closed rhinoplasty. When we do the small incision in the center, we call it open rhinoplasty. It doesn't matter whether open or closed, depend on the preference of the surgeon and the complexity of the deformity. Some of the humps are very simple. It can be done through a closed technique. Some of the humps are very large, and that will require a lot of work and correction of the dorsum, and we do it with an open technique. The other common deformity that affects the nose is the tip of the nose. Sometimes the tip of the nose can be very wide, or can be have a very thick skin. And then what we need to do is to remove some of the fat that under the skin, remove some of the cartilage, and then suturing the cartilage together and redraping the skin on them. And that's what we call a tip rhinoplasty. The nasal surgery, or all the rhinoplasty surgery, is relatively not very long procedure. It can be ranged from 1.5 hours to 2 hours. It can be done as a day surgery procedure. Patient can be discharged home the same time. Most of the patients, we apply on them a small splint to protect the nose and to decrease the edema and swelling that occur. And we leave this dressing and the splint for about 5 days. So the patient will have the surgery today. After 5 days, he will come, remove the splint, remove all the suture, and there is a swelling. This will take about 2 to 3 weeks to go, and most of the shape of the nose will be apparent in about 2 to 3 months. The final shape will take about 1 year, depending on the amount of surgery, on the thickness of the skin, and the type of the patient's skin. As I said, rhinoplasty is a complex procedure, but it is a very gratifying procedure for the patient. The surgeon sometimes can change the shape of the face and improve the appearance of the patient. The complication procedure is very limited. There is hardly any complication. Most of the problem we face with rhinoplasty is that the shape. The patient is not completely happy with the shape, and that can occur about 5 to 10%. And unfortunately, this needs to be corrected with another surgery, which we should do it not less than 1 year after the first procedure. I'd like to thank you for listening to me, and I'm willing to answer any questions in the future you can send me. Thank you very much.